Hello, everyone. This is Liz Cornell, and I'm here to talk to you about clients that may call you saying that their horse started bucking and they're trying to figure out what's going on, and they've called you in to help sort things out and maybe discover the problem. So let's move forward. There are basically three main causes for a horse to buck. One would be pain related, which is where you would come in. Another could be the rider aids. And the third option is it's become a behavioral problem for the horse. So we're going to focus on the pain, of course, since that's where you're going to have a lot of influence potentially. Now, the most common cause is going to be something going on in the back of the horse. Obviously, ill-fitting tack that's pinching somewhere could be a problem. Pelvis out of alignment. I've personally experienced that issue myself, so that's why I included it. Kissing spines and maybe something in the cervical. We've got mouth, teeth, TMJ, ulcers, and a large insect bite potentially, which has also happened to me. So I listed that as well. Okay, so the sore back. Obviously, in your massage work, you definitely want to do a lot of palpating of the back area and the withers area, the deltoids and the longissimus dorsi, etc. Even the SI, the psoas muscle in the back end, we talk about in a different presentation, and that should be checked as well. So the circled areas I've pretty much pinpointed are going to potentially be issues to check out. Now, except for the SI, most of those are either from the saddle or girth. So obviously that's why we're moving on to the tack. You want to have some basic saddle fit experience. So if you did get a response in those areas on the back, have them pull the saddle out without the pads, set it up there, and do some checking for them. Now, I'm going into the pelvic area misalignment. This is my mare, which I mentioned and discussed and showed you in the video I did on asymmetries in biomechanics. So this was her when I was in the middle of getting the pelvic aligned. So as you can see, her right pelvis was a lot higher. So in the training when she was younger, and I was I had taken the ANMR course, and so I definitely used her as one of my case studies. However, as time went on, it really took about a year in riding and adjusting her. I should say aligning her. I'm not a chiropractor, but using ANMR, I did finally get the left side up. Now, about 3/4 of the way through the process, she started bucking and the left canter depart. So that got me concerned because she really wasn't that sore anywhere, but I thought, gee, maybe she's getting pinched for whatever reason as the muscles are getting developed. And sure enough, I had a good session where I really got that pelvis lifted on the left, and she did a lick and chew. And the next ride, the left canter depart was perfect. So the bucking went away when I did that alignment. So square them up in the back, stand behind them, recommend a chiropractor if things look off kilter, or if you can certainly do ANMR if you're certified for that therapy. Let's move on to kissing spines. This is a phenomenon that's gotten very popular, it seems. A lot of things are blamed on kissing spines. In my experience, and if you talk to vets that have been around a long time, it's a little bit over diagnosed, I guess I would say. But I do have a couple of images here for you. On the left is an obvious kissing spine that I found. And the second one I'm bringing to your attention on the right because this is a client of mine, and she had a horse that was tossing its head actually, and it could buck, but not really. It wasn't really a bucker, but it did a lot of head tossing. And when she sent the horse to a trainer, he did explode and buck one day. That's true. I forgot about that. So that trainer said, your horse may have kissing spines. You need to have the x-rays done. So she went to her vet. She had the x-rays done. And the first vet said, yes, I think there's a kissing spine going on there. Then she showed it to a second vet, and the second vet said yes. Then she showed it to two more vets, and she didn't give much history, and they said, boy, that doesn't look like that would be a bad kissing spine. So she sent me that image, and I'm showing it to you on the right. And she questioned me. I did body work. I didn't find his back sore at all, but he had not been in work. So I said, well, the only way to know is if he's correctly ridden and the back is allowed to round up some, like it should, and that's the only way to know. So she did get the horse put back in work with a professional, and the horse was 100%. The horse is doing phenomenal, actually. So these were taken like a year and a half ago. So that was my advice. I'm not a vet, but since she got mixed opinions, she was confused, didn't know what to do. I looked at it. I said, well, I've seen much worse x-rays, so you don't know unless you put them back in work. So the last thing I'll mention is the neck cervical. I had a client once who, I'm bringing this up because this is a true story. She bought a horse, a beautiful Palomino quarter horse actually, and started bucking in the canter. And that's, if you notice, most horses when they buck, it's going to be in the canter because that's the gait where they're off the ground the easiest in terms of biomechanics. So this horse started bucking in the canter. So she sends it to she couldn't find anything wrong with it, so she sends it to a cowboy, and they decided it was behavioral, and it was a rough cowboy, but they did push him through it. So as time went on, every now and then, yes, the horse could buck. It was rare, but he could still buck. However, he started showing some bizarre lameness in his front legs. And she spent years trying to figure out, and they kept saying navicular, yet no matter what she did, and it was only would show up at odd times. So when she came to me, and this was more from a training capacity, I felt the horse probably had a problem in the neck because he would go lame on the front legs, and it was intermittent. It was very strange, but when we would put him in a round dressage frame, that's really when he started having issues with that. So in the end, it took me a long time to convince her to have his neck x-rayed. When we x-rayed the neck, we did find, or the vet did, C5, there was a shadow. You could only see the shadow when you had the horse's neck rounded. And sure enough, there was a little bone spur in there. And looking back, she's pretty much convinced that the bucking problem pretty much started from the pain in the neck because she was trying to ride him dressage at that time as well. So and since then, I have actually worked with some vets, actually in California, who is an expert on neck pain, and he said neck pain will manifest itself with all kinds of problems, a lot of lamenesses in the hinds, maybe bucking, if there's like a little pinched nerve going on. So I'm bringing it to your attention. It's a possibility. It's a little bit of a needle in a haystack. However, it can be a problem, and it would require obviously a vet to step in and do the neck x-rays. Same thing with the kissing spine. X-rays have to be done. Okay, other potential sources in your work, if you find a TMJ, a sore, even the masseter muscle, it could definitely be a mouth problem in the work, and I guess it can cause bucking. I haven't seen it personally, but people say that's the case. Ulcers, that can cause bucking. you put your leg in the wrong place and it might bother them. Large insect bites, you've heard the stories. I was on a trail ride and all of a sudden the horse started bucking and I think it got bit by a bee or something. Yeah, I mean, that can happen. So obviously there's nothing you can do about it as a therapist. But basically I find when there's a problem like this reported to me, you basically have to become a detective and you have to help them figure out what the problem is. And anything that you can't find, in soft tissue yourself and you suspect it's another area, you should advise them to contact a vet. I will tell you a quick story. I had a horse. I didn't palpate his back. One day I threw the saddle on. Very quiet, sane horse. Never, ever showed signs of a buck. I threw the saddle on, hopped on the horse. He was a bucking bronco. I did get hurt. It was a bad fall for me. And when I took off the saddle, I hobbled over, I caught him, checked his back, and sure enough, he had a bad bite. Even though he didn't respond to it, he didn't flinch at all with the tacking up or the grooming. When I did press right under the saddle there on the right side of his back, he was extremely sore. So he had some kind of bad insect bite. I'm to this day, I'm suspecting a spider bite. So those can suddenly rear their ugly heads, and this is why I always palpate the back of any horse I tack up to make sure there's no bad insect bites or soreness that might cause a buck. All right, now obviously many of you are not trainers. Maybe you are. As someone who does teach a lot of students, I will say that a super common problem with horses that buck in the canter, especially the canter depart, is too much inside rein contact. And that's a basic biomechanics thing. When the inside hind has to jump up underneath them in whatever lead they are on, that inside rein can block that leg, and that really can get the horses upset. So drop that inside rein and you'd be amazed how many horses are so much happier doing their canter work. Now, obviously, they can have some contact. It's just a question of degree of contact. So soft inside rein is really ideal. Reaction to spurs, seen it many times. One of my students did a flying change a few months ago, and she spurred him in the change, and boy, did he let out a buck, and off she went. So she makes sure that can actually, when you're teaching, you want to make sure that the rider has a quiet leg and has their foot and leg under control so as to not spur them incorrectly. Now, the whip is an interesting tool. It does work well for a lot of horses. However, I have found over the years whacking them on the butt somewhere will cause them to just kick out. It's very common. In general, the rule is to get them forward, tap the shoulder. To get them to collect and engage, you can tap the hind end gently. But if you really are trying to get them, perhaps, for example, to take the canter depart, don't whack the hind end. That's going to cause them to buck generally. And a horse may feel out of balance. In my biomechanics video, that with the asymmetries, I talked about balancing the horses that lean. And I just taught a student the other day. She bought herself a nice young horse, not young horse, but probably lacked some training, and they found that he was leaping and semi-bucking in the right canter depart. So in the lesson, I basically had her get him to stop leaning. I said, he's out of balance, he's upset. So some horses get upset when they feel out of balance. And the canter is the time when they're jumping off the ground, and this is the opportunity to throw in their discomfort or their opinion about it. So after a few tries, and we got the horse no longer leaning, taking weight over on his left hind, sure enough, he was taking the depart beautifully. So it's a training issue, and a lot of horses don't like being out of balance. And so if they're out of balance and there's too much inside rein in the canter depart for sure, then you're going to probably get a buck with a lot of horses. Not every horse, it depends. And then lastly, behavioral, that's a little bit out of your realm, of course, as a massage therapist, but certainly we've seen horses excited about, they're just energized, too much, pent up energy. Spooks can definitely cause a problem. It's happened to me. They spooked, turned, and bucked and took off. They're not happy about it. And then we have the horses that develop a bad habit. They've learned that if they get the rider off when they buck, then this is a good thing to them, and that has to be dealt with professionally. Or as they say, get back on the horse if you can when you've been bucked off. Otherwise, it can develop into a bad habit. So anyways, that's the whole video or presentation I have for you today about bucking horses. And obviously a lot of this are things out of your control, but if you can help these clients figure it out, they'll be very, very grateful.